Thanks, Parveen and Julie, for inviting me to talk about my career pathway, which I've entitled A Very Long and Winding Road. It's a very interesting time to reflect on my career, as I'm actually about to retire, or I'm just starting to retire, or semi-retirement. And it's really interesting to reflect and look back on my career and think about the factors that influenced my pathway, which was definitely long and winding. So I'd like to really start this talk by just really focusing on the NIHR that funded my career for most of the time. This is the main funding body to fund NHS research and increasingly social care research, and really has supported my career throughout, or sort of from when I started to become quite research active, and it's likely to support your career too. I'd like you to pay attention to the faculty and the training element of that. That is something that you can really think about approaching now. The main career pathways are through fellowships, but there's also some funding for introduction into research, good research practice, and other sorts of support. So the faculty, I suppose, as part of my career, I was actually mainly supporting people into fellowships, and I actually act as a mentor and an NIHR mentor. On the left-hand side, you can see the infrastructure, and again, an important area there is the clinical research network, particularly for you if you're considering career pathways. The CRN is about delivering research that's funded either through the NIHR or other faculties, other funders, and that includes charities and things like that. So, but actually what you can do is engage with the CRN through recruiting patients to those projects or getting involved in intervention studies. I was involved in it towards the middle and end of my career as the clinical lead for health service research and public health. And then finally, there's the research funding element. And obviously, although I've been part of the NIHR infrastructure through big collaborations that are funded, I've also had projects funded through the NIHR. And that is something that as your career progresses, you can focus on particularly research for patient benefit or research for people's benefit. And you can see in the middle of the diagram, it's looking at patients and members of the public. That is the whole purpose of doing research. And so it's really important for you to think about when you're getting involved in research, why you're doing it, and you're doing it for the benefit of patients and of services. So I've said, really, it is a very long and winding road with some bumps and blind corners. And I remember I was doing a similar talk to this at the Institute of Health Visiting NIHR conference, and other people who are also research active in from health visiting background have also said the same, that their career is not a straight linear path, but actually has twists and turns in it. And I think, to be honest, that's likely to happen as you look for opportunities and take on those opportunities when they arrive. And certainly that's what I did. I think things for you at the beginning or the middle of your research career pathway might be slightly different, because the Chief Nursing Officer's strategy is going to support clear research pathways in different ways, which include evidence-based practice pathways as well as more conventional NIHR fellowships. But I think, you know, the important thing is these things are not linear, and you should look for opportunities and create opportunities when you can. So looking back at my career then, I'll just focus initially on the beginning first steps of my career and how that helped me to prepare me for a research career pathway. So I suppose back in 1979, which is a long time ago, I actually undertook a Bachelor of Nursing course. That was a degree in nursing course at the Manchester University. It was a very, very rare thing in those days for nurses to have a degree and to train that way. And it was quite a unique course that was based both in primary and secondary care and did a good grounding in research methods. We did dissertations and evidence-based practice projects. From there on, I really focused on my practice or my practical career or my career in practice, where I really focused on community nursing. I specialised as a continence advisor, and I also worked for about 7 years, 6-7 years as a health visitor, while also combining that with some service development and evaluation projects. I took on a secondment looking at management of asthma in primary care with GP practices and school nursing. And that's the sort of thing that I did to really get my experience going. And I think that that's an important message for you, that actually the way into a research career is often through evidence-based practice, service development, and that's something you can do now in terms of using information, using data to inform services and make things better. And so that really was also my career pathway, is that I actually started to do more clinical effectiveness projects, and I became a clinical effectiveness lead. And then I had the opportunity to apply for a joint post between the School for Health and Related Research at the University of Sheffield and a community trust. So I had a joint appointment there. So in doing that, I started to get experience of evidence-based practice using data to inform services, and also through the joint appointment, boundary spanning. So by that I mean the link between the university and the NHS. So I was actually spanning the boundary between those two different sectors, learning to speak the language, feeling more confident in the ability to work across different languages and trying to find some common ground. That's really important. And can I just say, Julie and Parveen and I are doing some work with the Chief Nursing Officer at the moment, where we're working with an expert panel of research practitioners in nursing, and a key message there was most of them started their career pathway through service development projects. Okay, so the next pathway turn, if you like, was I actually took a leap of faith. I actually applied for a project, for a post as a Deputy Director of an evidence-based practice national collaborative in children and family social care, so trying to use the best evidence around social care practice within children and families. And I was actually encouraged to do that by a mentor. And the reason that I did that was I was getting really good skills in a way around knowledge mobilisation, getting research into practice, and I wanted to see whether it would be transferable to other contexts. So I suppose here was a really good sort of idea about boundary spanning, but not in the usual way. I was boundary spanning between the university and between social care and healthcare. So I was looking across the whole health system really, and in doing that we used evidence into practice, but also undertook evaluation, and I understood the different cultures between local authorities and the NHS. But that really helped me in good stead for my next post, which was to support a research and development centre at the School for Health Related Research, again in Sheffield, and I became the health and social care lead for that unit. I stayed there for quite a while, probably about 6-7 years, and became the director of that unit, and applied for further funding, continued funding, so that we could work as a research support unit, as a research design service. And so I suppose what I did there, that those posts within the support unit meant I was helping other people apply for funding, but also being co-applicant myself on those projects. So really those roles, the directors of the unit and the health and social care lead, meant I could do my own research whilst also support others. And I could do things like write papers. That was seen as an important output of that collaboration. So I was really lucky then to really have a much more firm ground in terms of having papers out and money in. And so I was able to apply for other funding. And as part of the Research Design Service funding, I actually supported and was co-applicant on a large collaboration called the Clerk, which was a 5-year funding of £20 million to do research within Yorkshire and Humber. And we did that. We were successful funding for 2 of those rounds, so that's 10 years of funding. And I think what helped me there was that again, I could demonstrate that I understood about the whole system. I knew about evidence-based practice and research, and you know, it was very close to practice. I had to actually return back to the NHS to continue my role within the Clerk. So I was, you know, literally going from university of the NHS and vice versa throughout my career. I also think my systems thinking helped me to apply for and get the clinical research network role as the health service research and public health lead. And also I again made a leap of faith and applied to NICE Guidance Committee for Public Health around really trying to develop guidance, national guidance for public health using research. And I worked for that organisation for NICE for 12 years concurrently with my Clerk roles and my research support unit roles. Okay, so I think what I'd like to really highlight is that it's not easy, but it's definitely worthwhile. I think in my context, I was also a single parent from quite early on in my career. And that meant that I actually had to really try and get some funding that's fairly stable, but that's actually non-existent in a research career that I had. So basically I had to keep on applying for funding to maintain my career and to pay my mortgage. So getting that balance right is really difficult, but it's about building your capabilities, your confidence to do that. And I have to say my career has been extremely fulfilled and interesting, and I've had lots of fun. So I'm going to now, and I suppose the next thing is to say that I have had good luck. I have been able to apply for things and show my skills and adapt my skills to apply for those jobs. But the thing is, there are opportunities, but I've been ready for them. And I suppose that's important for you. And I think one quote is sort of that found on the internet is readiness is the mother of luck. So that's really important to think about. And I would say that, that means that because you're having to look out for opportunities, it's not necessarily you take what's available, or you take what you think is going to be interesting and useful, but that isn't always necessarily conventional. Okay, so my next part of this presentation is to actually share with you what I think are the top tips for career pathways. First of all, I think make sure that you really are motivated by using research, evidence-based practice for the benefit of the public and services. That's why we do it, and that's why most funders will fund projects. So keeping that close to you and to your motivation is really, really important. Secondly, I think I was definitely bitten by the research bug. I found research really interesting from the beginning onwards. So I think it's really important that you should have a go, see if it's what you want, see if you actually get bitten by that bug, because I think I'm not necessarily usual. I do find research methods interesting. I don't know whether everybody else does. But the thing is also, it's about why you do it and the means to an end. The other thing is, I think you need to try and develop your expertise in a stepwise manner. Don't expect to do it all at once. Learn by doing. Start off with evidence-based practice. Work with a CRN to help recruit projects and build your expertise to see, is this what you want to do? But certainly find ways of dipping your toe in the water. I think it's really important to get some boundary spanning opportunities and skills. As you can see, I did that. I think, working across into the universities, either through doing some training, doing some teaching, collaborating on projects, getting a PhD, getting a master's, all those things are really important because you learn different language, you get more confidence in speaking across that boundary and actually helping to co-produce research as a practitioner and as an academic. And I think the other thing is, I found it really interesting spanning the boundary between health and social care. And I think more and more we're going to have to think across the system and do research around that. So that's the way patients go. That's the way the members of the public move around. They don't just stay in one part of the system. So really research should follow that. Another very important thing, I think, is to find and listen to people who can help you and have your interest, at their heart. So I think get a mentor, certainly a good role model or leader or supporter who knows you actually and can give you good advice, especially when you're thinking about your next steps. I can remember certain career transforming conversations with really important people that I really valued, and it did help me to sometimes take that next step, that big leap. And I think the other thing is you often hear about the career escalator, but that's not the real world. Or certainly if it is, you certainly have to get off at different floors, so that you consolidate and get your skills much sort of more fine-tuned and experienced in order to get on to the next level. So don't expect to just get on the bottom of the escalator and move up. Get off sometimes, consolidate, then get back on. And sometimes it's just keeping on going, that actually in consolidating you are improving, even though you don't feel that you're making progress. I think the other thing is try to think and develop your own USP, your own unique selling point, and then put it to good use. I think my unique selling points were that I could understand the whole system. I understood about co-production, knowledge mobilisation, so that means evidence-based practice, and I had the research capacity element that I actually researched and was very adaptable to different contexts. You might have a different USP, might be linked to your clinical area, or it might be to do like me, thinking about the research and the system. But try and find it, develop it, understand what it is, develop it, and then use it, and offer to use it in different contexts. A very important thing is to make connections and links. The more links you have, the more you can do. It helps with synergy and co-production. You can definitely think better with other people. It can help create opportunities, and it can also mean you can look for support. As you can see, I have actually made leaps of faith in myself at some times, and I think sometimes that's how you do progress. See how you feel about that. Certainly talk to people in order to prepare yourself for that leap of faith to see whether it's worth doing. But I think you should have a go. And the other thing is, form some resilience. Sometimes you'll go for jobs or you go for bids you don't get. Just take each step at a time and build on the previous step. If, obviously when you submit papers for journals, some of them come back where you have to make lots of changes, but that's what you do. You learn from each of those feedback loops, and that's the way you make progress. When you do get to a place where you feel that you're actually improving, that you're actually becoming a researcher or an applied evidence-based practitioner, it's important to help others, help them along their career pathway, or help them with those approaches too. All the evidence within the research capacity literature is that we should have role models, and we haven't got enough in nursing. So it's important when you do get there, make sure you're a good role model and help others. And finally, I think what's really important is that make good collaborations and enjoy yourself. That's important to keep a sustained career. Thanks very much. I certainly have enjoyed it, that's for sure. Thanks very much, and good luck with your future next steps.